tension? You're not pulling the head at all?
It's not
tension, or you just kind of like, you bring it there and then you let it go?
well. You want to bring it there and hold it there. It's not. It's not a scissors move.
Right.
You want to bring it around, hold it, and then
You
thrust.
hold after you thrust.
Yes. Yes.
And when you set up for this, you do your 45 with this hand, but your stance is a wide stance, and typically it will parallel his front feet. Okay? If you're like this, you don't have anything left to push with. You've taken all the power out of your body to push. So if you get in here like this, now I can lean in and I can push. Okay? So kind of double check to make sure that your stance is pretty much in line with his front feet. Okay? Now Dr. Abbey likes to kind of grab the other side of the face instead of the halter. So either way. Okay?
Just watch that you're not bringing the halter into their eye.
Yeah. And you can have kind of alert your handler, say, watch, make sure that's not getting in his eye. Okay.
Just be careful that you get your adjusting arm in the right position. Otherwise, you'll tear your shoulders out.
Kind of like
Yeah. You don't want to do that. That'll tear up your shoulder. Course of experience.
Yes.
So that's C3, 4, and 5, body right or left. Obviously the left would be the same thing on the other side.
My question to ask is, what else I said, am I being in the valley above or below the
Okay. Remember, your segmental contact point is the valley, right? When you motion palpate, what are you going? You're going to motion over the bumps or the hills, right? Because those are the facet joints. The primary school of thought in chiropractic, I believe, and correct me if I'm wrong, is on these guys. I believe it's Gonstead. If you motion into a facet and you find that it's stuck, you're going to drop to the valley below it to adjust. I believe that's Gonstead, and I'll stand corrected on that. If I'm wrong, I'm wrong. But you want to drop to the one below and adjust in the valley below. I'll stand corrected if I'm wrong. That's how I was taught. Like I said, I believe that's constant.
It's if I had a fixation between C2 and C3, then I would move to C3. Okay, so because you can't really adjust on C2 as far as a lateral
Body rotation.
Body rotation. So by convention, if you're going to adjust the set joint between C2 and C3 on the valley below, pretty much just stay with that the rest of the way down. I know Joe and I have discussions about this all the time.
We talked about that more than once.
Yeah.
I think a lot of this depends on which chiropractic theory you ascribe to. For our purposes here, we won't say to you there's a lack of motion between C3 and 4, so set up to adjust the one that's stuck. We'll say C4 body left. We expect you to go to the valley of C4 and set up on that one for body left.
So we make it easy for you. Okay?
Anything else on 3, 4, or 5? So the last two are 6 and 7. Remember, we called those ugly, and it was a combination of two people's names, not because it was kind of ugly, even though it is. Sometimes you can get to 6 without having to lift the leg, but most of the time, especially with 7, you're going to have an assistant help you by lifting the leg and retracting it caudally. So Dr. Donnelly is going to bring that leg a little bit caudally toward the tail to get the shoulder blade out of the way, so that Dr. Ennis can get to the proper segmental contact point. Your LOC now is more lateral to medial because the facets are changing to the orientation of the thoracics. So it's no longer at that 45-45, they're becoming more coronal.
So it's pretty much straight lateral.
Lateral to medial.
You just adjusted it, right?
you just suggest it? Did you just suggest
It may have.
No.
I don't know, I don't think so. It may, I didn't feel it. I didn't push on it.
Those are a little tough. Remember also with this, the adjuster, the doctor handles the lead rope again. So technically, he would have had the lead rope in his right hand because his left hand was his contact hand. So he's going to grab the halter with the rope in his hand and then set up. Are we okay if they can get to 6 without lifting the leg, or do we want to lift the leg for both of them?
You guys.
Change starts at 7. Joint changes at 7
Right.
and 6. Changes at 7.
So 7's really the only one we need to do.
Yeah, the only thing is if you can't, if they've got a real slopey shoulder, and that's got good covers up 6, then you're going to have to get it out of the way.
Yes.
Just take them off the leg.
Thank you.
Just take them off. 6 is always exploded if you use the space of both. No, it's true. If you press the ball, see, you can always get 6 without that.
Yeah, okay.
I know the worst sometimes you just unweight them or get them
Yeah,
to stand.
right, that's what I'm saying. Unless they've got a real slopey shoulder, then covers maybe hard on them. So those are the cervical listings and setups for the cervical spine. You guys have any questions about any of those?
Lunch.
Lunch will be here at 11.
Is it here?
I don't know yet.